Hey guys, hope everybody's having a good day. As you can see the lights back there. Anyway, okay, giving a quick update after the meeting today with the oncology team. So went to Baptist today and met up with, actually it was really good. I like the way they do this. They do kind of the multidisciplinary type of meeting. So first we met with the oncology surgeon, the one that would be doing the first phase of this. Sorry, Roxy thinks it's time to play ball right now. Okay, so met with the oncology surgeon, then met with the oncologist that would be treating me after the surgery, and then also spoke with a genetic counselor. Was supposed to meet with the plastic surgeon, but he was actually working emergency cases today, so he ended up not being able to meet with us. So, and that's not me breathing heavy. That would be Roxy. You know, there you go, Roxy. Yes. Okay. So, yeah. So started with the. I'm going to try to focus. So we started with the surgeon, and essentially, the choices that were given to me were. Oh, I need to answer the first question that I've been given. So it's stage 1. So. Praise the Lord, the news that we were hoping and praying for, that's the earliest stage. So that's really good news and what we were hoping to hear. And then also my integrative doctor actually did some testing and looking at those levels for, I think it's like cancer activity, I forget what it is. But anyway, looking at those levels, if it's above a certain level, then it's a concern for spread. And both of my levels that he checked were below. So that was good news. So the options as far as like, how much are we taking away? What are we going to do? Option 1 was a lumpectomy. With the lumpectomy, then basically their standard and kind of requirement expectation would be to do radiation. And that is essentially, I don't know how long that would be or whatever, but I was asking about, survival rate. One of my concerns is that when you look this information up, that a lot of the time all you can find is data on 5 and 10 year survival rate. I am 47. I plan on living a hell of a lot longer than 5-10 years. And so my concern was, what does the data look like, longer than that? And I thought it was interesting because what they basically said was that the study was from 1977 and 1982, and they track those patients, but they can't really give data past the 5 or 10 year mark. So something doesn't make sense. Like, are these patients dying off? I don't know, but I thought that was really interesting. But basically, as I said, if I did a lumpectomy, then the expectation is for me to do radiation, which I really don't want to do. And so I've been thinking and praying about this. And I was leaning towards the mastectomy. Reasons for that, even though it's just in the lymph nodes, with the mastectomy, then, looking at keeping it from getting anywhere else, or from spreading into any other, sorry, it's just in the mammary glands, trying to do this. There's a dog right here. Okay. So right now it's just in the breast tissue. And so we want to keep it just there and then get it removed, get it, kill the cancer cells off and get it removed. So essentially I was already heavily leaning towards the bilateral mastectomy. That way, looking at, return rate, things like that, because that's what I asked them, like, in what percentage of patients does it return, not just, survival rates, but also like, when is it likely to come back, et cetera. So based on that, if I do the mastectomy, then I wouldn't do radiation, and then we're just getting rid of the tissue. So I have it scheduled for October 23rd to do a bilateral mastectomy as well as to do an explant. So I know that a lot of people, like after they have their, mastectomies, what they do is they replace it by essentially doing, do implants. Well, for me, I think that the implants that I got 20 years ago and had them changed out 9 years ago, I believe that is probably causing some other inflammation. And for the sake of having healthy breasts full time, I want them out. So I did clarify with them, is there a reconstruction option without implants? And yes, there is. Unfortunately, the plastic surgeon was busy with emergency surgeries today, so I was not able to meet with him. I'll have to meet with him later. But with the plastic surgery, with the reconstruction surgery, essentially what it would be is removing fat from another part of my body and basically placing that in my breast. So because of the fact that it's not going to be breast tissue, it's not going to have the ducts, the glands, et cetera, then no, it's not going to increase the risks. That was one of my questions, is if I put other tissue in my breast, will it, keep the risk higher, or is there potential for it to come back? So the answer to that was no, it is safe, and it is approved by insurance companies. So I'm incredibly grateful for that. Yes, I'm looking at the side benefit side of things too, but that's not why I'm doing it. It is important to me to rebuild those. So I know some people say it's just superficial, but as a female, unless you're in those shoes, like that's a very personal decision. So that's where I am. I met with the oncologist after that, and we talked about the options. Now, when they do the mastectomy, they will also do, they'll also get sampling from the sentinel nodes, from 1 to 3 on the left breast. And basically, it's looking to confirm that the cancer has not spread to any of my lymph nodes. All indications are, at this point, that it has not spread to my lymph nodes. They need confirmation of that, of course. That is the standard. And so they will also do something called, and I've never heard of this before, but it's called oncotype DX, or maybe it's diagnosis, sorry, sometimes I just abbreviate, but oncotype DX, I think is what it's called. And the point of that oncotype is to look at what's driving the growth, as well as to determine the risk of recurrence. And there was something that I kind of alluded to on one of my earlier go lives, but I didn't want to bring it up because I wanted to, find out more information about it. But it's called I didn't bring this in here, but I think it's called a KI. Oh, here we go. I think I've got it right here. It's a KI67, I believe. Yeah, KI67. And with the KI67, it's kind of a controversial marker, but basically what they've said is that if that value is above 20%, then it is considered a fast multiplying cancer. And so my KI67 value was 40%. The more research that I did, the more that I saw it was kind of, again, controversial because some people believe in this, some people don't. So that was one thing that the oncologist brought up was, yes, this plays a small role in it, but the Oncotype DX will give us more information. There's a certain threshold with the Oncotype DX, and that is basically if the level is considered low, which is below 26, then chemotherapy is not needed. If, however, the level is above 26, then chemotherapy would be recommended. And I have already basically told her that she's going to have a hard sell with me for chemotherapy. Now, I'm going to say this now before I get messages. I don't mean to be rude. I know you guys have the best of intentions with this, but please understand that this is my body. This is my battle. So I've gotten a few messages of do everything that the doctors tell you to do. The doctors are specialists. They focus in on just that part. When I ask them about, what's triggering it, what other things are you doing? Or is there nutritional counseling? It was really discouraging because essentially what I was told is that the nutritional counseling pretty much is, yes, it's technically available, but it's only really used for patients who are having things like that. They have tube feeding that they, essentially that they aren't able to eat. That's kind of where they use their nutritional counseling. As far as, looking at the data on nutrition and how that impacts things and looking at things on like a metabolic level, that is just not part of it. Yes, it is a, big multidisciplinary team. I'm grateful to have met with everybody. But yes, there are big red flags because this is a whole body issue. It's not just one area as far as where this comes from. So, I'm grateful because it's going to be 2 months from now that I meet with the oncologist again, because I will have the surgery October 23rd, and then essentially she said that she wanted to meet with me 4 weeks after that, and that's when we'll decide the protocol. So as I'm working through this heavy protocol with my integrative medicine doctor, where we're looking at killing the cancer cells, apoptosis, all that, then she'll be able to run those labs again and kind of see where things are, as well as to have this information. So we'll have a lot of diagnostic information to make these decisions off of. But I did say that if chemotherapy is something that is pushed, I'm only doing low dose. So we already kind of, I'm basically setting the standard of what I'm willing to do. But I'm also willing to do a hell of a lot more than most patients, because a lot of patients will just say, okay, just tell me exactly what to do. I'm just going to do the bare minimum. And I'm looking at how do I take this and take this learning opportunity that God is giving me, and also advocate and educate other people, for taking control of our health, for making better choices, and for looking at not just the short term, but the long term. Because again, a lot of cancer data is just 5 and 10 years out. I don't plan on dying in 5, 10 years, so I want more than that. Call me selfish, but I want to be here for my kid. I want to be here for my grandchildren. So that's where I'm looking at attacking this from all angles. Okay. Then I also met with the genetic counselor. And the genetic counselor, there were a couple of interesting things that I learned from that. And I did not take all the notes on this for the different ones. So I'll be able to share more of this later. I know my friend Meg was with me, and thank you, Meg, for being there. So freaking appreciative. Because I can't remember what all they mentioned. But essentially what they wanted to do is basically kind of do like a family tree. And my tree is fairly small. My mom had 2 half siblings, and then my dad has 2 siblings. And one of those half siblings on my mom's side, we just found out about a couple of years ago. But, looking at what's the family history, how much cancer is actually in there, and not just breast cancer, but also, thank you, Roxy, but also prostate cancer was one of the other ones, as far as being indicative of, future breast cancer from other family members, et cetera. And so it was just a matter of doing like the BRCA testing, the BRCA, and the point of that would be to determine whether or not to push for a full mastectomy. Since I have already made the choice to do a full mastectomy, then that's not necessary. But the other thing is, I had a hysterectomy several years ago, but I still have my ovaries. And so it could determine, or it could tell me like if there's an increased risk for me to get ovarian cancer. I would rather work on trying to get all of this stuff under control and doing that than putting myself in too much fear. But also my question was, okay, how's this going to impact other insurances? What will that impact? Having a history of breast cancer is already going to, for any future like life insurance policies, et cetera, would jack that up. But also genetics, testing for having the BRCA gene could also jack up life insurance or long-term care insurance, that kind of thing. And then I did talk to my financial advisor, a wonderful financial advisor if somebody's looking for one. And yes, he works with people, locally as well as long distance. But, I asked him, I was like, okay, for Emmy, is this going to matter if I do the genetic testing? And he said, at this point in time, no, that does not count against them, because I have to look at the fact that, with her having epilepsy, and then with having, me having breast cancer, and then on her dad's side, there's strong multiple kinds of cancers, is it going to hose her for things like that? So those are things that I'm trying to process and think through before making any knee-jerk reactions. So at this time, I declined the genetic testing. But also, so the factors for determining if I'm a strong risk or whatever would be, first of all, being under 50. So I hit that. I checked that box. But also if there's 3 or more family members with a history of cancer. And so at the time when I went in there, basically the other family members that have had a history of cancer were like my mom's half-sister. But my understanding was that, so they shared the same dad. But my understanding was essentially that the breast cancer was strong on the mom side, which they didn't share mom, they shared a dad. And then a few years ago through Ancestry.com, we found out that, yes, my grandmother had actually had another son before she had my mom. And, we connected with the daughter. So she's my cousin, half cousin, whatever. So she had reached out to me and let me know that she had been diagnosed with breast cancer a few years ago. She was over 50. It was a slightly different type of breast cancer. But she actually did have the BRCA testing done, and hers was negative. So I just, for the sake of looking at, having full information, I've opted out of doing the genetic testing for now. I think that's the full update. So summary, it's stage 1, the best news that we could have gotten. I have my... I just went blank, my mastectomy and my explant surgery scheduled for October 23rd. And then I will meet with the oncologist like the Tuesday after Thanksgiving to determine what the next steps are. I should be getting some of the test results and stuff, because they load in the portal. Just based on state law in North Carolina, they have to release them immediately. And then once I meet with the plastic surgeon, then I'll have a time frame for more, having a better idea of when, when that second surgery will be, but they said basically probably like 2 weeks out from the first surgery. As far as needs, things like that, that first night, October 23rd, I will have one night in the hotel, or not the hotel, I will have one night at the hospital, so one night hospital stay. So I will be working on figuring out like who's going to stay at the house with Sarah and the dogs, just making sure that she can get to and from school and practice. And then also making sure that the dogs are taken care of, because I really do not want to board the dogs. I would rather that they actually have somebody taking care of them. So that is the update for today. I am so grateful. Thank you guys so much for all of your love and support. I really and truly appreciate it. It's been, a tear-filled event, and I just hope that somebody else can learn from my experience. And I know somebody else was like, I was worried you were going to say, like, go get a mammogram. I'm not saying that I'm not a healthcare professional. Go with your gut. Do your monthly exams. Be better about it than I was. But if you believe something is off, then figure it out. Pursue it. I will say that for the last couple of years, I knew something was a little bit off. I knew that my health was out of touch. I knew that my inflammation was up, but I couldn't put my finger on it. And I didn't do enough to really take control of my health. So, I think we all have to own our journeys and our mistakes. So anyway, thank you all so much. I appreciate you. Have a wonderful evening.